Welcome to another episode of the Science Guide ASAP Learning, where we simplify complex medical topics. Today, we're going to delve into an intriguing area of psychiatry that illustrates the complex interplay between mind and body: somatic symptom and related disorders. Somatic symptom and related disorders are a category of psychiatric disorders characterized by an intense focus on physical symptoms that cause significant distress or impairment. It's important to clarify right at the start that these are not imagined symptoms. The physical symptoms experienced by patients with these disorders are real, although they cannot be traced back to a specific medical condition. The DSM-5 lists several disorders in this category, including somatic symptom disorder, illness-anxiety disorder, conversion disorder, functional neurological symptom disorder, psychological factors affecting other medical conditions, factitious disorder, and other specified somatic symptom and related disorders. Each has distinct criteria, which we'll discuss in detail. Let's start with somatic symptom disorder. It is characterized by one or more somatic symptoms that are distressing, or result in significant disruption of daily life, with excessive thoughts, feelings, or behaviors related to these symptoms. These could manifest as a high level of anxiety about health or symptoms, disproportionate and persistent concerns about the medical seriousness of one's symptoms, or excessive time and energy devoted to these symptoms or health concerns. Illness-anxiety disorder, previously known as hypochondriasis, is characterized by a preoccupation with having or acquiring a serious illness. Here, somatic symptoms are not present or, if present, are only mild in intensity. If another medical condition is present or there is a high risk for developing a medical condition, the preoccupation is clearly excessive or disproportionate. Conversion disorder, also known as functional neurological symptom disorder, involves symptoms or deficits affecting voluntary motor or sensory function that suggest a neurological condition. However, these symptoms are incompatible with recognized neurological or medical conditions and are not better explained by another medical or mental disorder. Psychological factors affecting other medical conditions is diagnosed when psychological or behavioral factors adversely affect a medical condition by influencing the course of the condition, interfering with treatment, posing additional health risks, or exacerbating or precipitating the symptoms or condition. Factitious disorder, previously known as Munchausen syndrome, involves falsification of physical or psychological signs or symptoms, or induction of injury or disease, associated with identified deception. Lastly, other specified somatic symptom and related disorders is a category for symptoms characteristic of a somatic symptom and related disorder that cause clinically significant distress or impairment but do not meet the full criteria for any of the disorders in the somatic symptom and related disorders diagnostic class. The diagnosis of these disorders must be approached with sensitivity, as patients are often wary of the stigma associated with psychiatric diagnoses. A thorough clinical assessment should be conducted to rule out any underlying medical conditions that could explain the physical symptoms. In cases where a medical condition is present, it's important to determine if the patient's concern about their symptoms is excessive or disproportionate to the medical condition. Treatment of somatic symptom and related disorders involves a combination of psychotherapy and medication. Cognitive behavioral therapy can help patients learn new ways of understanding and coping with their symptoms. Antidepressants and anti-anxiety medications can also be helpful in managing some symptoms and any coexisting mental health conditions. To conclude, somatic symptom and related disorders are a diverse group of disorders that highlight the profound connection between the mind and the body. As future healthcare professionals, it's critical to approach these disorders with empathy and understanding, to provide our patients with the best possible care. Hope this helps. Please support this new channel by liking this video and subscribing for more videos like this one.